Welcome to this MRI anatomy overview of knee joint. In this session, we will highlight the key structures of knee joint like bone, ligaments, cartilage and menisci. And we will also see how they appear in MRI. And this will help you understand the knee's complex anatomy, and it will also help to diagnose the knee pathology. So let's begin with the basic anatomy overview of knee joint. So it is the largest synovial joint, provides flexion, extension and slightly rotation. And MRI is the gold standard for the soft tissue evaluation of the knee joint. And it has the two components, bones and soft tissue like muscle and ligaments. And there are three compartments. So bones include the distal femur, proximal tibia and fibula and patella. So these four bones form the knee joint. And there are three compartments, that is the tibiofemoral compartment, which has two compartments, medial and lateral tibiofemoral compartment, and the patellofemoral compartment. So there are three compartments in knee joint. MRI sequences used for the evaluation of knee joint are the T1 weighted, T2 weighted, proton density fat set and Easter images. So in T1 weighted, fat appears bright, T2 fluid bright. In PD, that is the proton density, it is best for the evaluation of ligaments, and for fat suppression is used for the highlight of the edema. So PD fat set or Easter used for the highlighting edema. Now the structures evaluated in the sagittal plane of MRI are the ACL PCL, meniscal horns, extensor mechanism and articular cartilages. Now the anterior cruciate ligament. So this is a band-like structure we can see here. This is the band-like structure is anterior cruciate ligament, which originate from the anterior tibial spine and insert on the lateral femoral condyle. Here we can see that this is the coronal section, this is the sagittal and this is the coronal, and this one is the axial section. So it attaches on the lateral femoral condyle and it is a oblique low signal band. Now another one is the posterior cruciate ligament or PCL. It is a thick curved structure and it is a homogeneous low signal intensity. As we can see this sagittal image, this is a low signal intensity, whereas we can see in coronal image, this is the PCL. This one is the PCL. It originates on the tibial plateau posterior aspect, whereas attaches on the lateral aspect of the medial femoral condyle, as we can see here. And it is a very thick curved structure, so it is stronger than that of the ACL. Now another important structure of knee joint are the meniscus or menisci. There are two meniscus, medial and lateral meniscus. They are C-shaped structure, and medial meniscus is larger than that of the lateral meniscus, and they have anterior horn, posterior horn and body. So both have anterior and posterior horn and body. As we can see, this is the body in sagittal image, and they appear triangular dark structure in sagittal image. As we can see in this image, they appear as a triangular dark structure in sagittal image. This is the anterior horn, posterior horn, and they have free edges, so form triangular shape. So these are the meniscus. Now the extensor mechanism. Extensor mechanism include the quadriceps tendon, patella tendon. So we must evaluate for the thickness, continuity and for the evidence of tendinosis, and also check for the patellar alignment. Now in coronal plane, we should evaluate the medial collateral ligament. This is the medial collateral ligament, dark structure, lateral collateral ligament, meniscal body, tibial plateau and articular cartilages. In axial plane, we evaluate for the patellofemoral joint. As we can see, this is the patella and this is the femur, retinaculum on either side, and trochlea, as we can see here, trochlear group. So it forms joint with the patella, and neurovascular bundle, that is the popliteal artery, vein and the nerve. Artery and vein are the popliteal, but nerve is the tibial nerve. Key exam tips are the confirm findings in two planes, never diagnose on single slice, use proton density image with fat suppression or stir for the ligament injury, and compare medial and lateral compartments. Now the conclusion is MRI provides excellent soft tissue detail, systematic approach prevents error, and strong anatomy knowledge improves reporting. So thank you for watching.